Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
When it comes to back pain, conventional treatments like surgery and medications can be very effective, but they aren't the only options out there. More and more people are exploring alternative therapies like acupuncture, chiropractic care, as well as yoga, Pilates, more than ever before. If you're not in a rush to go under the knife or are concerned about getting addicted to pain meds, today's show is definitely for you. We are going to give you the 4-in-1 on effective alternative therapies, as well as answer your questions on this episode of Ask the Doc. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Ephraim, who asks, "Hey doc, I bent over to pick up my toddler's daughter last week and my back went out. I can't tell if it's the muscles or my spine. My GP suggested pain meds, but being a recovering addict, I'm thinking that it's not a great idea. My brother suggests acupuncture, but I'd like to know how it works as well as get your thoughts on it first." Hi Ephraim, thanks for reaching out with your question, and I'm sorry to hear that you're in pain. Look, this is a great question, Ephraim. When it comes to back pain, conventional treatments like surgery, medications can be very effective. And they aren't the only options out there. More and more people are exploring these alternative therapies like acupuncture and chiropractic care, yoga, Pilates. So if you're not in a rush to go under the knife, if you're concerned about getting addicted to pain meds, then this show is definitely for you. And Ephraim, your question, I'm sure is something very important to a huge number of people. I'm glad you brought up the issue of narcotics, because narcotics really should not be the way that we treat back pain, especially not chronic back pain. Now, in your case, to figure out whether it's muscles or is it your spine, to take pain meds, acupuncture, these are all relevant questions. And that's really the most important question. What is my diagnosis? But here's the deal. Most musculoskeletal pain related to muscles, to bones, to joints, it actually gets better on its own. So Chinese have been using acupuncture for at least 2,500 years. And yet we don't have great literature where a group with back pain undergoes acupuncture, and then we compare that to a group that didn't. Now, that being said, the studies on acupuncture are ample, and some of them, larger series, actually are pretty convincing. Now, how does it work? I really don't know. And when you read the sort of explanations behind these textbooks on acupuncture, it doesn't really go along with the standard Western evidence-based medicine approach. Whenever we start to talk about energies, classic sort of medical thinking just shuts off. But whenever we look at alternative treatments, let's also ask a question of, well, what's the downside? And it seems that with acupuncture, there's very little downside. So Ephraim, my advice to you is try it, see if it gets better. But if within 2 or 3 sessions you're not seeing a significant difference, then let's get an MRI and let's get to the bottom of the problem. Let's get to a diagnosis. Our next question comes to us from Jean-Marie. Jean-Marie question is, Dr. Brusovanik, my family recently moved to South Florida and I just hurt my back while moving our new furniture around. Haven't figured out the right layout yet. Anyways, we don't have a new primary care physician yet. So I'm thinking about going to a chiropractor. What should I know before going to one? So I'm a spine surgeon, and for some reason, everyone just assumes that I have something against chiropractic care, and that's totally untrue. I think that chiropractors fulfill a very important role. I think that chiropractic manipulations have been shown to be effective about non-specific axial back pain. I think that most ethical chiropractors will agree that if you have nerve pain or pain that goes down your legs, that you really should not undergo manipulations. But there are definitely some benefits to chiropractic medicine. And there are definitely some things for you to be aware of. So if you have non-specific back pain after an exercise, it's reasonable to go to a chiropractor. If you have acute back pain, a spasm, it's reasonable to go to a chiropractor. But if you start to feel pain going down your arms, down your legs, if you feel the searing sciatica type pain, then chiropractic manipulations may make you worse. In fact, if those nerve symptoms have converted to numbness or weakness, then I would really strongly advise you against chiropractic manipulations. Now, that being said, many chiropractic centers actually incorporate physical therapy into their armamentarium. And I think that ethical, goal-oriented physical therapy is very beneficial as well. And you may get that by going to see a chiropractor. Again, though, with physical therapy, 72 sessions, and if it hurts, that's good. That's not the right approach. The approach should be, what is my diagnosis? What are these exercises going to achieve? And then you got to be able to see progress or an improvement in your symptoms. Thank you for this really good question, Jean-Marie. And I would welcome you to try chiropractic care. And if it doesn't get better, consider talking to your PCP to get an MRI to get to the bottom of why you're suffering. To those who are wondering how to send in questions, please consider both the social media pages as well as our website, allhealthtv.com. It is chock full of important information. It will give you an opportunity to send me questions, which I really appreciate. Armando reached out to us on YouTube. Hey, Dr. B, my gorgeous new girlfriend, Corinne, is big into yoga and thinking about becoming an instructor. So she wants me to start taking classes with her. I'd walk on burning coals for her, but are there really any benefits to it? And are there any poses that can help with a bad back? Armando, yoga is like acupuncture. It has been around for thousands of years. So there has to be something to it. The studies are not great. And I think that if you have severe pain, you need a diagnosis, not yoga. Now, that being said, though, how can I say anything negative about yoga when there are just hundreds and thousands of people who swear by it, who use yoga to maintain their shape, who use yoga to maintain flexibility and stamina? Now, I have one possibly intelligent comment to make. With the recent popularity of Bikram yoga, you'll find that when you go into this hot room, you can do more. Somehow knees and hips become more stretchy, elbows become more stretchy. You can bend your neck backwards more and forward more. I wonder if that hyperflexibility that is temporarily imparted by the increased heat may subject you to worsened pain. And sometimes I do hear patients say that they went to yoga and they went into a severe spasm and their pain got a lot worse. I think that if you do yoga regularly, then yoga is the way to go. I think that if you have not been doing yoga for a very long time, or if you've never tried it and you are in pain, I don't think that yoga is a legitimate treatment option for pain. I hope this answers your question, and thank you again. I really appreciate this very important and question that I'm sure many, many people can relate to. Welcome back. We have a question from Scott through allhealthtv.com. You should really check out this website. So Scott, hi, Dr. Brusovanik. I've been dealing with a lot of stress lately, and I think it's having an effect on my back. Whenever I get anxious, my back muscles seem to tighten up, and then the pain begins. My shrink suggests that I give biofeedback a shot. I've never heard of it before, but I'm not a big prescription guy. What can you tell me about it? Biofeedback. Scott, thanks for reaching out, and I'm happy to hear that you're open to new things. Biofeedback is basically a way to learn how to control some of your bodily functions, like your heart rate and muscle tension. So to be objective, biofeedback is not necessarily the best for common back pain. Now, if you've proven to yourself that your back pain is associated with increased stress, increased blood pressure, then it's reasonable to get a blood pressure cuff, maybe even a pulse oximeter, maybe even a watch that measures your pulse, so that when you feel stressed, when you feel that crazy energy, you can check your pulse, and if the pulse is high, you can maybe do some breathing exercises and meditate. But that being said, blaming back pain on stress should be sort of what we call a diagnosis of exclusion, meaning that only once you know that it's nothing else, okay, well then it's maybe just your stress. There's been a lot written about this. And a particular paper that I like to quote to my patients is an article on catastrophizing. In other words, patients who have chronic back pain, when they feel that that pain will never leave them, when they feel that their life is over and they're going to spend the rest of their life in pain, as compared to patients who don't have that sort of negative thinking, these patients who catastrophize really do worse long term. So from that point of view, I would really like to advise you and really take this as a very positive message, that most back pain is curable. Most back pain will get better on its own. And if it hasn't gotten better, we can make most back pain go away. I hope this limits your stress somewhat. And if you do try biofeedback, I really hope that the blood pressure and the pulse are the cause of your pain, because if you get control over that, you will get better. Thank you for this really great question. I appreciate it. All right. We've got another question from allhealthtv.com. Dottie asks, hello, doctor. I was on a tennis team in college and was pretty darn good. I'm a little older now, but I still hit the court every weekend, mostly to stay in shape. Needless to say, it takes longer to recuperate, and my back has become a problem area, especially when I'm using my backhand. My wife, Hadley, has suggested using hot and cold therapy to help reduce inflammation and tissue damage. What do you think? Dottie, I see so many tennis players, and tennis players, golfers, and baseball players, due to the rotational component of their sport, present with a little bit of a different list of common diagnoses. In other words, the possibilities are a little bit different for that group as far as what's causing their pain. For example, common back pain is sitting pain, but when I get up and get going, it gets better. But tennis players will often say that I pay for it after I play, I feel stiff in all positions. And if you are having that kind of pain, then there's a higher possibility than from the average population that your pain is coming from the very joints in the back of the spine than from the most common culprit, which is the spinal disc. Now, if it is indeed the joints in the back of your spine, that's kind of good news, because there's a great non-surgical way to address that pain. When it comes to conservative stuff, there is a myriad of things that you can try. But purely hot and cold may be beneficial only in the early stages, in other words, right when the pain begins, or in a severe spasm. And whether it's cold or hot, you'll be surprised to hear my advice. Try either one. In some spasms, you want to quote unquote bring in the blood supply. I'm not a big believer that bringing blood flow to the area is necessarily going to cure you, but patients sometimes feel that the heat is better for chronic pain. Maybe it's via distraction, maybe it's via increasing blood flow. Cold, as you know, is a vasoconstrictor, so cold may be more beneficial for an acute injury. But again, don't assume that hot or cold are going to cure you. I would not waste time on hot or cold if you are going for those 3 physical therapy sessions, and I would focus more on strengthening and stretching. And finally, if you do apply hot or cold to your skin, please make sure to pad the source of the temperature, meaning whether it's the hot pack or a cold pack, and pad the skin, because you can burn the skin. I've seen this on my patients, and please don't leave it on for more than 20 minutes. I really appreciate this question, and you'll find a lot of debate about what's best, hot or cold. So please take this purely as my opinion, not necessarily as something that's based in good science. Thank you, Beverly. The next YouTube question comes to us from Colin. Hey, Dr. Brew, I'm a hardcore cyclist, but my back has been giving me a problem for a while now. I was going to physical therapy, and it helped for a while, but not so much anymore. the PT suggested that I give Pilates a try. Pilates always seems a little through, and there's a Pilates studio in the same building, and it looks like a medieval torture chamber. Thoughts? Colin, I love your question. I appreciate the outreach. Some of the Pilates machines may look a little scary, but they're actually pretty beneficial. Pilates is great at helping patients work on their core. When patients ask me if they should try Pilates for back pain, my initial response is usually no, because unless you've been doing Pilates for a long time and that's your normal, if you're in pain, that's not necessarily the easiest way to begin, quote unquote, core strengthening. I think that the exercises are excellent. And I would love it if you try Pilates once your pain gets better. In the meantime, if you are having pain and therapy is not working, the answer isn't to join another gym. It's to get why you are suffering. It's to get an MRI, to get a proper physical exam, and to really diagnose your problem. Colin, I'm not trying to dissuade you from trying Pilates, and possibly if you try it, you'll love it. Most likely you'll love it. So many people do. I would just really encourage you to get to the bottom of your pain, and you really don't need to keep suffering. If you've got a question, we've got answers. Welcome back, everyone. Mandy just sent us another YouTube question. Mandy asks, Dr. Brusovanik, I was in a car accident recently and hit from behind. I felt okay at first, but over the next few days, my neck and back began to ache. I know this sounds cliche, but my primary care physician is sending me to a physical therapist. Having never gone before, what can I expect? Mandy, I'm sorry to hear that you've got hurt. What happened to you is pretty typical in these situations, and oftentimes the early burst of adrenaline that's associated with a car accident will make it so that you don't necessarily feel the back and neck pain. Plus, if other parts got injured, your wrist, your knees, your ankles, that may also distract you from pain. Car accidents can worsen pain that comes from degenerative discs. Car accidents can cause herniations. Now, I'm not a big believer in sending patients in pain to physical therapy before obtaining a diagnosis. So my direct advice to you, Mandy, is that if you go to therapy and your therapist is real gentle and you just get better, the question is going to be, did the therapist help you get better, or did you get better on your own? On the other hand, if you're suffering with pain going down the arms or down the legs, with a type of pain that we call nerve pain, then you need an MRI before you try physical therapy. Finally, those who've been doing therapy for a long, long time and not seeing results, I would strongly advise you to take a step back, obtain a diagnosis. And once you do, and once you know exactly what's causing the problem, therapy may be essential in getting you back on the road. Thank you for this really great question. Okay, our next spine-related question comes to us from Darcel. Hi, Dr. Brusovanik, I hate my boss. I'm sorry, Darcel. She's angry, arrogant, accusatory, and has created a toxic work environment. Darcel, I can only commiserate with you on this. I'm stressed all day, and it's having a negative effect on my body, especially my neck and back. My therapist wants me to practice mindfulness and meditation. Sounds a little woo-woo to me. How about you? It sounds a little woo-woo to me too. But there may be some truth to you internalizing these work-related stresses. I'm biased. I don't think that blaming stress is the way to go. I think that if you have pain, you need a diagnosis. And if your pain only comes in at work, try to seek out another factor that's related to your work that may be causing your pain. For example, if you're having back pain when you sit, then you are presenting with the most common complaint, because degenerative discs hurt most when you sit. If you're typing on the computer or you're doing paperwork and you are in a flexed forward posture for your neck, then that may be the cause of your pain. Plus, you may just have back and neck pain from disc degeneration, and not necessarily your arrogant, accusatory, and in general, boss who you hate. And I'm sorry that you're suffering. I'm sure that so many patients have the same problem with their bosses. Seek a diagnosis before you blame your boss. I hope this helps. Okay, I guess it's an allhealthtv.com kind of a day. This next question comes to us from Janice, who asks, Dr. Brusovanik, just how effective is massage therapy in managing spinal pain? And what techniques are most effective? Janice, at the risk of significant punishment from the world of the internet, I don't think massage has any curative elements to your back pain. I love a massage. Sometimes my patients tell me that they need to have a massage every week in order to keep their back pain under control. To those patients, I applaud your optimism, but like to everybody else who needs something to just maintain while suffering from pain, mashing your back muscles isn't going to fix your problem. If you have pain when you sit, if you get up from a chair like an old person, if you have difficulty walking, if laying down is a problem, mashing your back and neck isn't going to fix it. So a gentle massage is reasonable and enjoy if you do. A massage that causes pain may be a good distraction maneuver for an internal derangement that's causing your pain. But I don't think that continuing massage is the way to go if you're suffering. I think that the right answer is to get a diagnosis. And to those who swear by the masseuse, if it works, do it. Please don't hate me for just expressing my opinion. Now, Stephen asks through allhealthtv.com, Dr. Brusovanik, can dietary changes or supplements help with spinal pain relief? If so, which ones are recommended? I guess it's a Dr. Brusovanik as a negative news Nelly kind of a day, but Stephen, there are really no supplements whatsoever that have been shown in good studies to help with pain relief. We used to say that vitamin D and calcium are helpful in maintaining bone health. We now know that they are less effective than we thought. Everything else just gets worse and worse. We are not sure which vitamins can help with back pain. There are no good studies, and there's very little quality control on your vitamins. So if you've got that big container of vitamins that you have to take every day, where it becomes more like a meal instead of a supplement, I urge you to get a diagnosis. Glucosamine and chondroitin, calcium, vitamin D, vitamin E, vitamin K, none of that is going to take away your back pain when it comes to looking at scientific evidence and studies. Moshe asks, and this one is from YouTube. Hi, Doc. How important is posture in preventing and managing spinal pain, and what practices can help improve it? Moshe, that's a really excellent question to close out the show. We all think that we are to blame for our back pain, and that it's because I sit so poorly. That's what I hear all the time. And that's no different than those patients who say, I slept wrong or I picked up something wrong. You don't need to blame yourself. The problem comes from inside. Your posture is an expression of the posture of your spinal column. You can't really affect your posture. My mom used to push on my back when I was a kid to make me sit upright. There's great evidence that that does not add to the future posture of your child. Wearing backpacks on one side is not going to make them have scoliosis. Neither will wearing a symmetrical backpack on both sides prevent it. Your posture comes from inside. And if you feel like you have to force yourself to sit upright, it's a futile effort because your pain will come back once the muscles fatigue. I want to again thank you so much for this question, Moshe, and to all the viewers who've tuned in. Please feel free to send us questions. The more the merrier. I appreciate it tremendously because these questions, I'm sure, can sound off within the minds of so many of our patients. See you next time on allhealthtv.com. And thank you again for coming to our show.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.